Ladies and gentlemen, let's talk honestly about a subject many men shy away from: why erections change with age and what you can actually do about it. This is not just about intimacy, it's about overall health and vitality. When we talk about erections, the most important factor to understand is that they are essentially a vascular event. Erections are not just about desire, stimulation, or hormones. They depend almost entirely on how well blood can flow into and stay inside the penis. The penis is made up of spongy tissue that fills with blood when you are aroused. As men age, vascular health naturally declines. The lining of blood vessels, called the endothelium, becomes less flexible and less efficient at producing nitric oxide. Nitric oxide is a key chemical that signals the smooth muscle and arteries to relax so that blood can flow more easily. Without enough nitric oxide, the arteries cannot dilate properly, and this limits the ability of blood to enter the penis. Over time, the arteries may also develop small deposits of cholesterol and fatty material, leading to atherosclerosis. This process doesn't just happen in the heart or brain, it happens everywhere, including the tiny penile arteries. Interestingly, the arteries in the penis are much smaller than the coronary arteries of the heart. That means even a small amount of blockage in penile arteries can cause noticeable erectile difficulties years before heart disease or stroke becomes obvious. High blood pressure, high cholesterol, diabetes, and smoking all speed up this decline. High blood pressure puts constant strain on blood vessel walls, damaging them over time. High cholesterol clogs those vessels, making them narrower and less efficient. Diabetes damages both blood vessels and the nerves that help control them, creating a double impact. Smoking is perhaps the worst offender because it constricts blood vessels in the short term and accelerates plaque buildup in the long term. All of these factors compromise circulation, and poor circulation means weaker or less reliable erections. Another important aspect is venous leakage. Even if blood enters the penis, it needs to stay trapped long enough to maintain an erection. As men age, the tissues that compress the veins may weaken. If those veins cannot seal properly, blood leaks out too quickly, leading to difficulty maintaining an erection. This is why some men say they can get hard initially but cannot stay hard for long. This is not always a failure of arousal, but often a vascular issue. The good news is that blood flow can be improved at any age. Regular exercise, especially aerobic activity like walking, running, or cycling, keeps arteries flexible and boosts nitric oxide production. Strength training supports overall metabolism, reduces fat, and improves vascular health. A diet rich in fruits, vegetables, whole grains, and healthy fats protects blood vessels and prevents cholesterol buildup. Quitting smoking and reducing alcohol can dramatically improve circulation within weeks. For men who experience very low testosterone, sometimes called hypogonadism, medical treatment may be necessary. Blood tests can measure levels, and doctors may recommend testosterone replacement therapy when lifestyle measures are not enough. This treatment can restore libido, improve mood and energy, and support erectile function, but it must be carefully monitored since it comes with risks if not properly managed. The important point to remember is that while testosterone naturally declines with age, men are not powerless in the process. By protecting hormonal health through lifestyle and, when necessary, medical support, many of the effects of aging on erections and sexual desire can be slowed or even reversed. When it comes to erections, nerves and muscles play just as critical a role as blood flow and hormones. Erections are not only about circulation, they are also about the delicate communication between the brain, the spinal cord, and the nerves that travel down to the penis. This nervous system signaling is what allows arousal to be translated into a physical response. When a man becomes sexually stimulated, the brain sends electrical messages through the spinal cord and into the pelvic nerves, which then trigger the release of chemicals like nitric oxide to relax smooth muscle and allow blood to fill the erectile tissue. If those signals are weakened, slowed, or disrupted, the ability to get or maintain an erection is compromised. With age, nerves naturally lose sensitivity. This happens throughout the body, not just in the penis. The protective coating around nerves, called myelin, begins to thin out, and the speed at which messages travel along those nerves slows down. The same way that vision or hearing may not be as sharp at 60 as they were at 20. Penile nerves don't transmit signals with the same intensity. Muscles are equally important in this process, especially the pelvic floor muscles. These muscles sit at the base of the pelvis and are responsible for supporting the bladder, bowel, and sexual organs. When it comes to erections, pelvic floor muscles have two major jobs. They help trap blood inside the penis by compressing the veins, and they contribute to the rigidity and upward angle of the erection. Strong pelvic floor muscles also play a crucial role in ejaculation and orgasm intensity. As men age, just like any other muscle group in the body, the pelvic floor muscles weaken if they are not trained. Weak muscles mean weaker support, less control, and less ability to sustain an erection. Another factor is that prolonged sitting, which is common in modern lifestyles, puts pressure on the nerves and muscles of the pelvis. Sitting for hours on end compresses the pudendal nerve, a major nerve involved in erections, and reduces blood circulation to the pelvic muscles. Over years, this can contribute to both nerve dysfunction and muscle weakness. That's why men with sedentary jobs often experience more issues with erections compared to men who remain physically active. Fortunately, just as you can exercise to strengthen your arms or legs, you can also strengthen the pelvic floor muscles. Exercises known as Kegels, which involve contracting and relaxing the muscles you use to stop the flow of urine, have been shown to significantly improve erectile function and control. Studies have demonstrated that men who perform these exercises regularly not only maintain stronger erections, but also experience better ejaculation control and more satisfying orgasms. In addition, activities that improve overall muscle tone and circulation, like yoga, Pilates, and resistance training, support nerve and muscle health in the pelvic region. Nerve health can also be supported through good nutrition and lifestyle habits. A diet rich in antioxidants, vitamins B12 and D, and omega-3 fatty acids helps protect nerve tissue and promotes regeneration. Avoiding excessive alcohol and managing blood sugar are equally important, as both alcohol abuse and uncontrolled diabetes are major causes of nerve damage. Regular movement throughout the day, standing breaks, and stretching also prevent long-term compression of pelvic nerves. Together, these strategies keep the communication lines between brain, nerves, and muscles as sharp as possible, ensuring that the physical response of an erection remains strong even with advancing age. Lifestyle choices are one of the most powerful influences on erections, and in many cases, they can make the difference between maintaining sexual function as you age or losing it prematurely. Erections are not just a reflection of sexual health, they are a mirror of overall health, and the way you live day to day directly affects how well your body performs in the bedroom. Men who smoke heavily. Finally, physical activity is one of the most protective lifestyle choices for erections. Regular exercise strengthens the heart, improves blood flow, regulates weight, lowers stress, and increases energy levels. Aerobic exercises like walking, running, and cycling improve circulation, while resistance training helps boost testosterone naturally. Even simple activities such as stretching, yoga, or regular walking reduce pelvic tension and improve blood flow to the lower body. Men who remain active throughout life consistently report better sexual health compared to those who are inactive, proving that the way you move every day has a direct impact on how your body performs in intimate moments. Erections depend on a delicate balance of blood flow, hormones, nerves, and muscles, and medical conditions that interfere with any of these systems can have a profound impact on sexual health. As men age, the likelihood of developing chronic diseases increases, and these conditions often play a much larger role in erectile decline than aging alone. In fact, many men in their 60s or 70s with excellent health still maintain strong erections, while others in their 40s may struggle because of underlying medical issues. Erectile dysfunction is often one of the earliest warning signs of disease, appearing years before other symptoms become noticeable. One of the most significant medical conditions affecting erections is diabetes. Diabetes damages blood vessels and nerves, both of which are essential for sexual function. High blood sugar levels over time make arteries stiff and narrow, reducing circulation to the penis. At the same time, they damage the sensitive nerves that carry arousal signals from the brain and spinal cord. Heart disease and high blood pressure are also leading contributors. The same vascular blockages that cause chest pain or heart attacks also affect the tiny penile arteries. Because these arteries are so small, they often show symptoms first. A man may notice weaker or less frequent erections years before experiencing angina or other signs of cardiovascular disease. High blood pressure adds to this by constantly straining the vessel walls, making them less elastic and less capable of delivering blood during arousal. This is why erectile dysfunction is sometimes called an early predictor of cardiovascular problems. Treating high blood pressure and improving heart health often results in better sexual performance as well. Prostate conditions are another major factor. Prostate cancer, its treatments, and even benign enlargement of the prostate can all interfere with erections. Surgery and radiation for prostate cancer may damage the delicate nerves and blood vessels that run along the prostate and control erections. Although nerve-sparing surgical techniques have improved outcomes, many men still experience erectile difficulties afterward. Neurological diseases also play a role. Conditions like Parkinson's disease, multiple sclerosis, and spinal cord injuries interfere with the communication between brain and body that triggers erections. Since arousal depends on electrical signals traveling smoothly through the nervous system, any disruption in that pathway can lead to difficulty initiating or sustaining an erection. These conditions are complex, but treatment strategies aimed at protecting nerve health and optimizing overall function can still make a difference in sexual performance. It is important to note that even medications used to treat chronic conditions can sometimes worsen erectile issues. Drugs for high blood pressure, depression, or anxiety, while necessary for overall health, may have side effects that impact erections. In many cases, a doctor can adjust the type or dose of medication to reduce these effects without compromising treatment. This is why open communication with healthcare providers is so important when erectile changes occur, because they can often identify whether the problem is from the condition itself, the medication, or a combination of both. Managing stress and prioritizing sleep are often overlooked but have profound effects on erectile health. Chronic stress keeps the body flooded with cortisol, which suppresses testosterone and interferes with arousal. Constant mental tension also makes it difficult to focus on intimacy, reducing both desire and performance. Relaxation techniques like meditation, deep breathing, or yoga help reduce stress and improve overall well-being. Sleep is equally vital because testosterone is produced during deep sleep cycles. Men who consistently get 7 to 8 hours of quality rest have healthier hormone levels and better erectile function compared to those who are chronically sleep deprived. For men already experiencing medical conditions like diabetes, high blood pressure, or prostate problems, prevention means actively managing those conditions with the guidance of a healthcare provider. Keeping blood sugar under control, monitoring blood pressure, and following treatments consistently can dramatically improve erectile performance. Sometimes medications themselves may cause side effects, and in such cases, discussing alternatives with a doctor can make a big difference. In situations where lifestyle changes are not enough, medical treatments such as oral medications, vacuum erection devices, or other therapies can provide support, but they work best when combined with healthy daily habits. The key point is that men are not powerless against age-related changes in erections. Staying active sexually, maintaining physical fitness, eating well, managing stress, and taking medical conditions seriously create a strong foundation for lifelong sexual health. The body responds positively when it is cared for, and erections are no exception to this rule. Exercise is one of the most powerful tools for preserving erectile function. Aerobic activities like walking, jogging, cycling, and swimming improve cardiovascular health, which directly translates to better penile circulation. Strength training boosts testosterone, builds muscle, and helps regulate weight, all of which are crucial for sexual vitality. Even specific exercises for the pelvic floor, such as Kegels, strengthen the muscles that trap blood in the penis and help sustain erections. Studies show that men who consistently perform pelvic floor exercises experience firmer erections and improved control compared to those who do not. Making exercise a daily habit is not only about longevity and strength, but also about maintaining sexual performance. Nutrition is another cornerstone of prevention and improvement. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports vascular health and hormone production. Foods high in antioxidants, such as berries and leafy greens, protect blood vessels from damage. Omega-3 fatty acids from fish and nuts help reduce inflammation and keep arteries flexible. Limiting processed foods, refined sugars, and unhealthy fats is equally important because they contribute to obesity, diabetes, and clogged arteries, all of which damage erections. What benefits the heart almost always benefits the penis, making a heart-healthy diet one of the simplest and most effective solutions. Although aging brings natural changes to the body, the decline in erectile function is not inevitable, and many men maintain strong, reliable erections well into later life by taking care of their health and remaining sexually active. The concept of use it or lose it applies perfectly here because erections themselves are a form of exercise for the penis. Each erection brings fresh, oxygen-rich blood into the erectile tissue, keeping it flexible and healthy. When erections become infrequent, the tissues can gradually lose elasticity, blood vessels may narrow, and nerve sensitivity may decrease, creating a cycle where erections become even harder to achieve. Regular sexual activity, whether through partnered intimacy or solo activity, helps maintain penile health by keeping blood flow strong and tissues functioning properly. Even benign prostate enlargement, a condition that affects most men as they age, can cause urinary problems that indirectly affect confidence, intimacy, and erectile function. Fortunately, new therapies and rehabilitation techniques are helping men recover sexual function after prostate treatment more effectively than in the past. This dual effect makes erectile dysfunction extremely common among men with diabetes, and it often develops earlier than in men without the condition. Poorly managed diabetes can also lower testosterone levels, creating a triple hit to sexual health. The encouraging part is that with better blood sugar control, exercise, and weight management, many men with diabetes can improve or restore erectile function. Obesity is another key factor. Extra body fat, especially around the abdomen, doesn't just affect appearance, it alters the hormonal balance in the body. Fat tissue converts testosterone into estrogen, lowering available testosterone levels and weakening libido. Excess weight also increases the risk of diabetes, high blood pressure, and heart disease, all of which directly damage erectile function. Studies show that obese men are far more likely to struggle with erectile dysfunction, but losing even a modest amount of weight can restore both hormone balance and vascular health. Sleep and stress are lifestyle elements that often get overlooked, but they are just as important. Poor sleep disrupts the body's natural hormone production, particularly testosterone, which is produced during deep sleep cycles. Men who consistently sleep less than 6 hours a night often have significantly lower testosterone levels than men who sleep well. Stress, on the other hand, floods the body with cortisol, a hormone that suppresses testosterone and keeps the body in a state of tension. High stress also makes it harder to focus on intimacy, which further disrupts the mental and physical connection needed for arousal. Smoking is perhaps the most destructive lifestyle factor for erections. Every cigarette introduces toxins that constrict blood vessels and reduce oxygen delivery. Over time, smoking accelerates the buildup of plaque in arteries, a process called atherosclerosis. Because the penile arteries are smaller than most arteries in the body, even a slight narrowing can restrict blood flow enough to cause erectile difficulties. Research shows that men who smoke are up to twice as likely to develop erectile dysfunction compared to non-smokers, and the good news is that quitting can lead to noticeable improvements in just a few months. Alcohol in moderation may not cause major issues, but heavy or chronic drinking is a different story. Alcohol is a depressant, which means it slows down the nervous system. This affects arousal signals from the brain to the penis, making it harder to initiate or maintain an erection in the short term. Over the long term, excessive drinking can lower testosterone levels, damage the liver, and disrupt sleep, all of which contribute to erectile decline. Many men notice that when they cut back on alcohol, both their energy and their erections improve significantly. Drink excessively, carry extra weight, or live a sedentary lifestyle often notice changes in their erections earlier and more severely than those who take care of themselves. That is because all of these habits slowly damage the delicate systems of the body that support sexual function, particularly blood vessels, hormones, and nerves. This means that even if arousal is present in the mind, the body's response can feel delayed or weaker. On top of this, certain medical conditions common with age, such as diabetes and multiple sclerosis, damage nerves directly. Diabetes, in particular, is one of the leading causes of erectile dysfunction because high blood sugar levels over time damage the small nerves that are essential for sexual function. Another factor to consider is that low testosterone is often associated with other health conditions that also impact erections. Obesity, type 2 diabetes, and metabolic syndrome are all linked to lower testosterone levels. Excess body fat, especially belly fat, converts testosterone into estrogen through an enzyme called aromatase. This hormonal imbalance further lowers testosterone, creating a cycle where weight gain leads to lower testosterone, which then leads to even more fat accumulation and worse sexual function. Sleep apnea is another condition that reduces testosterone, and poor sleep in general disrupts hormone production. Men who consistently sleep less than 6 hours a night often have significantly lower levels compared to those who sleep well. The decline in testosterone with age is natural, but lifestyle choices can either speed it up or slow it down. Regular exercise, particularly resistance training, has been shown to increase testosterone levels. Maintaining a healthy weight and avoiding excessive alcohol also help keep hormones balanced. Managing stress is equally important since chronic stress elevates cortisol, and cortisol directly suppresses testosterone production. Even small daily habits like getting morning sunlight, eating enough protein and healthy fats, and ensuring deep restorative sleep can make a noticeable difference. Isn't just about sex drive, it influences body composition, muscle mass, mood, sleep, and even memory. So when levels dip, the changes can show up in many ways: lower energy, loss of motivation, irritability, or difficulty concentrating. In the context of erections, low testosterone doesn't always directly cause erectile dysfunction, but it strongly impacts desire. Without adequate libido, arousal signals to the brain and body are weaker, and that chain reaction is what reduces erection quality. The brain is the starting point for arousal, and if hormones don't fuel it properly, the rest of the system doesn't respond as effectively. There's also an indirect connection between testosterone and vascular health. Testosterone supports nitric oxide production in the endothelium, the same chemical that allows blood vessels to dilate. With lower testosterone, nitric oxide signaling may not be as strong, making it harder for blood to rush into the penis during arousal. In this way, hormonal decline and vascular decline often work together, compounding the problem. Even simple daily habits like staying hydrated and getting consistent restorative sleep support vascular function. Hormones play a central role in sexual health, and among them, testosterone is the key player for men. Testosterone is the hormone that drives libido, energy, confidence, and even contributes to the strength of erections. When levels are healthy, sexual desire feels strong, and erections tend to be more reliable. As men get older, however, testosterone levels naturally begin to decline. On average, testosterone decreases about 1% per year after the age of 30. This decline is slow and gradual, which is why many men don't notice it right away, but by the time someone reaches their 40s, 50s, or 60s, the difference in hormone levels compared to their 20s can be significant. When blood vessels dilate, blood rushes in, and the veins that normally drain blood out get compressed, trapping that blood inside. That's what creates rigidity. So when blood flow is healthy, erections are strong. But when blood vessels begin to stiffen, narrow, or get blocked, the first place you may notice a problem is in your erections. In fact, many doctors often say that the penis is like a check engine light for the heart. If blood flow is compromised, the penis is often the first organ to show signs before the heart itself has symptoms.